We are all right. Hello, everybody. So, this is the end of Heart Health Awareness Month for 2026. And what I wanted to do was come in and bring you a case study. For those of you who don't know me, my name is Trinette Stanford, and I am a nurse practitioner and diabetes educator. But also, I am a patient. So, what I want to tell you about is pulmonary hypertension. Pulmonary hypertension is a condition where the right side of the heart has to work overtime in order to get blood circulating to the lungs. And I am going to share my screen in order to show you. Okay, this is the heart. And over on this side, this is the normal circulation. This is the right ventricle. The heart has four chambers. The right atrium, right ventricle, left atrium, and the left ventricle. The left ventricle is the workhorse of the heart. It is the power, it's the one that has to pump the blood throughout the entire body. Contrast or compare that to the right side of the heart. The blood doesn't have to work as hard, so it just has to circulate the blood to the lungs right there. And as long as you have normal circulation to the lungs, it's no problem. So the right the right ventricle, the right chamber, right lower chamber of the heart doesn't have to pump and doesn't have to work as hard. So we call it like the passive part. But when you have a narrowing of the pulmonary artery, the right side of the heart has to work harder. And what happens over time, it gets larger because it has to work so hard in order to pump the blood in order to get to the lungs. So, so you're saying, well, what does that got to do with anything? It has a lot. What happened was, I'm gonna stop sharing for right now. Um, I have been pretty active, even though I am older. I'm what you call, I am geriatric, really. I'm over 65. I'm over 70. But I have been very active. I have been always, I exercise, been, I exercise several times a week. I do weights, I do cardio, and from time to time we have a 5K track close to me, and from time to time I would go and walk the track without any problems. And then one time I noticed that at the end of it, I was really having trouble breathing. So I thought I was just out of shape. I was deconditioned. And I was like, ooh, I got to get back in shape because I'm not accustomed to walking like this. And we had gone on a trip. I had gone on a trip with a group of friends and we rode the bus. And we went to one location and we were staying at a hotel. Then I got ready to get out of the bus, go to my hotel room, and I was short of breath. Just going from the bus to the hotel, walking to the desk, and I was out of breath. And I noticed that as I walked, or I could not carry my suitcase because I was short of breath. And I was like, that's not normal. So um, I did go to the doctor and he looked and referred me to the cardiologist and thought it was just some swelling in my legs, so put me on a water pill and things seemed to get better. But I did go see the cardiologist, went to see the heart specialist, and they did some tests, and that's when it showed that I had pulmonary hypertension. But she assured me, she said it's early. This is stage one. So, switch my medicines around a little bit and let me know that, like the strenuous exercises, the intense exercises I was doing before then, I needed to ramp it down a little bit. I could not exercise as intense as I was doing. And she didn't have to tell me that because it's like I didn't like being out of breath. So, fast forward a few weeks ago, I noticed increased problems breathing. And I was like, what is going on? I didn't understand. So it took a while before it finally got to me. I said, I need to go to the hospital. I told my husband, I said, we need to go. Excuse me. And I said, I need to go to the emergency room. And from the short distance from walking from my bedroom to the kitchen, I was completely out of breath. And I said, no, you need to call an ambulance because there's just no way I was going to subject him to driving me because we have to drive over 30 minutes to get to the nearest hospital. So EMS came. They did blood pressure, blood sugar. Oxygen saturation was low. Started me on oxygen in order to get my levels up. Blood pressure was fine. Blood sugar was fine. It was just my oxygen level was low. So get to the emergency room and they start doing tests and everything. And the nurse comes in finally and she tells me, she said, okay, you're going to be admitted. You're going to intensive care. And I was like, what? And she said, you have blood clots. I had blood clots in my lungs. So, um, as it ended up, because the hospital was full, it was during the flu season. So I did not go to intensive care, but they did admit me and I had some tests done. And sure enough, the next day I went to the cath lab and I did not show a picture of that. Anyway, it's kind of gross. Um, they removed a lot of blood clots out of my lungs. So, what happened? What's the mechanics of all of this going on? So, let me share my screen again so I can show you. And I didn't want that. Oh, okay, let's shrink that down. Oh, okay, come on, act right. And of course, there we go. Okay, what happens? And pulmonary hypertension can be a very silent occurrence. Why does it happen? It can be a number of things. I know in years past, that's one reason some of the weight loss drugs were taken off of the market because it was one of the side effects that caused pulmonary hypertension. In my case, I didn't have any of the risk factors, so I think in order to cause it was just one of those things. So what happens is pulmonary hypertension means it's high blood pressure in the lungs. And it's a mechanical problem, okay? That it's just too much pressure in the lungs. And think of it as think about a water hose and how a water hose has to be unwound, no kinks in it, in order to get the water to flow to the end of it. And here's another analogy. Think about drinking through a straw. If you have if you have a soda and this is the size of a regular straw, you can suck it in without any problems. But then here's a coffee stirrer and it's a smaller straw. You have to suck harder in order to get the liquid through that smaller opening. And that's the same thing that happens with pulmonary hypertension. The right side of the heart has to work harder in order to get the blood to circulating. So in my case, for some odd reason, the blood was stagnating in the lungs. And let's see if I can go back to that picture here. Okay. Ignore all the other stuff. What happens if the blood is not flowing as it should to the lungs, it can stagnate. If the blood is too thick or the vessels are too small, that blood gets stagnated here and it can cause clots. It develops into clots. So in my case, and that's kind of busy, I'm sorry. Um, but anyway, if you ignore all the stuff on the other side of the screen. In my case, the blood clots that they took out was it was in the shape of all of these, of all through here. It was a chain of blood clots through here. And that's what was causing the problem with me breathing. The air could not get through these areas. It was either air's going to travel or blood's going to travel. But in my case, both was not doing it. So after the doctor went in and he did a heart cath, he brought in the equipment and he cleared most of these clots out of here. And immediately after that, I felt better that the blood was circulating and I could breathe. The blood was circulating, the air was circulating, I was able to breathe. So here's another picture that can happen. Um, Again, with the hypertension, there's a kink here. And so that water or the blood does not flow as it should. Or another analogy, you could drive on the highway and you're on a four-lane highway. Think about driving the highway in Atlanta and you have four lanes on each side, and then all of a sudden there's a traffic jam and you're down to one lane, and how long it takes in order to get through that congestion. That's what happens with pulmonary hypertension. So, and this is an illustration of going from a four-lane highway to a one lane. And this is the way those blood clots looked that they took out of my lungs. I mean, it was just like this. Like this one nurse told me, she said, it looked like pomegranate seeds. And that's the way it looked. So, and I am going to go back to the screen, to the regular screen. Okay. So, what happened after, I'm going to stop sharing. That's what I was looking for. Like I said, immediately after that, I was able to breathe. Oxygen level improved. They were able to decrease the oxygen that I was receiving and I didn't share that. The whole time before it, they had to put me on 4 liters of oxygen, which is really high. 4 liters of oxygen in order to keep my oxygen level up, and it was at 90. Normal oxygen level is between like 97 to 100. Would like it in the high 90s. I was running in the 80s, and that's why they had to put me on supplemental oxygen in order to keep my oxygen level up. After they removed the clots, they were able to wean me down from 4 liters to 2 liters, and my oxygen level was better, and it had improved. The whole time, my blood pressure was fine. In fact, my blood pressure was low. So that is a good thing. Now, like I said, I don't know what caused that. They Sometimes you can have like a DVT, what they call a deep venous thrombosis, where you can have a blood clot in your leg, and that blood clot can travel from the leg up to the heart, can cause problems. I didn't have that. They did ultrasounds in order to look at my legs to see if there was any clots there. It wasn't. They also checked my abdomen to see if there was any clotting there, and it wasn't. it was just one of those things that happened. And I thank God that it stopped at the lungs because blood clots release going to the body can go to the heart to cause a heart attack or go up, um, travel up the veins of, travel up the arteries of the neck and go to the brain and cause a stroke. And I thank God that I did not have either one of those because it was bad. It was bad enough. It was still a life-threatening condition, but it was something that was treatable. Now, what what can I do in order to improve my condition? All right, I am on blood thinners. And there's two schools of thought about that. One provider, the pulmonologist, the lung specialist, said, well, we usually keep you on blood thinners about 6 months and then you can stop them. That's one school of thought. Cardiologists, hospitalists said, you're on blood thinners for the rest of your life. And based on the fact that it was not any precipitating problems that caused this. It was unprovoked, what we call an um, unprovoked problem. I am leaning toward the fact of staying on the blood thinners because that was scary. It was scary. When you are face to face with your mortality, it's like, okay, you start looking and start analyzing things. And I said, you know what? And the thing is, that blood thinner medicine, the the size of that pill is like the tip of this pen, and you can't even see the ball the ballpoint end. That's how tiny that pill is. So it's like it's no big deal on me taking that pill. Also, I have to, I still exercise, all right? I'm not going to stop doing that because I truly believe, and my providers concur with me, because my baseline, my underlying condition, I was healthy. Even though, yes, I do carry some extra pounds, but I exercise frequently. Um, I manage my stress. One thing I didn't share, and I need to back up a little bit. When I was first diagnosed with the pulmonary hypertension, they did recommend me to go on a CPAP. I did do a sleep study, and it was borderline. I really didn't need I didn't have sleep apnea, but because of the pulmonary hypertension, they thought with the CPAP, it would increase the oxygenation and it would improve the blood flow and improve the oxygen flow to my lungs. So I said, okay, no problem. And because I had been on the CPAP, I think that was another reason why recovery was swift. The recovery was so much better. So I have been using the CPAP. I continue to use it, and what it does, it helps with my quality of sleep. So that's another thing. I use my CPAP every night. I exercise, but I do it in moderation. I still do the weights. I still do weight training, but I do not lift as heavy of weights that I used to lift because I noticed that when I did the heavy weights, I really got short of breath. So I was like, okay, let's ratchet it down some. So I went to the lighter weights, doing more repetitions, and I feel better. I feel better with that. Also doing the cardio. But with the cardio, again, I moderate the rate. I do not do super high intense exercises. They are low intensity. I exercise every day, but it's usually maybe like 25, no more than 30 minutes a day. So because I don't overdo it because overdoing it can cause as many problems as not doing anything. Because what happens if I exercise too much, that causes my heart rate to increase, and that causes the right side of my heart to have to work harder. And I do not want to put any more stress on the right side of my heart. I would like for it to start relaxing and functioning as it should. Other things that I do, making sure that I eat I I eat healthy foods, that I do large amounts of fruits and well, do large amounts of vegetables. I don't eat a lot of fruit, but I do a lot of vegetables, especially the non-starchy vegetables like the greens and the squashes, carrots, things like that. Protein, I do protein because I am older. I do need the protein in order to maintain healthy cells. So, no, I do not avoid meat. And in fact, the protein helps to build up healthy cells, and plus it helps keeps my blood sugar stabilized. No, I don't have diabetes, but I want to keep it that way. Okay. And um, but the biggest thing in anybody with heart health, number one, make sure that you, especially as you get older, make sure you go and get checked out. Make sure you have your your checkups. Make sure you have your blood work. And then when you have your blood work, have your provider go over the blood work with you in order to discuss any potential problems or any risk factors that you may have. Also need to look at your health history. What did what kind of problems did your parents have with their health or your grandparents? A lot of times people don't know what happened to their family members. So I know I didn't know. Um, I came from the generation where my folks said, whatever happened in this house stays in this house, and whatever I do is my business. Well, I'm of the other school. Whatever happens to me, I need to let my children know because they are at risk of developing the same things. So I let them know so that they can get checked out also, because prevention is the best medicine. So, um, whatever health history you have, whatever health problems, even if you know some health issues with your parents, share that with your children, share that with your grandchildren, and so that they can stay on top of things in order to prevent problems. Okay, so what do I do differently now? I weigh daily. I check my weight daily because one of the problems with pulmonary hypertension, sometimes I have a tendency to hold on to excess fluid. So I weigh daily, and I use that weight in order to determine if I need to take a water pill or not. Also, I check my blood pressure daily to make sure that it stays at a normal rate. And since that is since this has happened, my blood pressure has been really optimal, like the low 100s, sometimes 90s, which is fine. Um, but I monitor it daily and I record it. And some if you have health problems, the best thing you can do is to keep track of what's going on in your body. Blood pressure cuffs, you can get a blood pressure cuff that is automated, and it will take your reading for you. Rule of thumb that I have with when you're checking your blood pressure, when you put it on your arm, make sure your arm is at the same height of your heart, and have both feet flat on the floor. Don't cross your legs or anything. And also empty your bladder before you check your blood pressure. And then that way you'll know um, that's an accurate reading. And then record it. What I do, I have I have the calendar on my phone. I have an extra calendar on my phone, and I record my blood pressure and my weight and pulse reading so that when I go to my provider, they'll be able to look and see how my blood pressure and everything has been running. So that is what I can do. That is the proactive steps that I'm taking in order to take care of my health. And those are the things that I recommend for people to do. There are things that you can do in order to help your provider take care of you, take the best care of you. So, like I said, weigh daily. When you weigh, do it first thing in the morning, after you empty your bladder, before you drink any water. And that's what we call a dry weight, and then record it. Blood pressure, like I said, I, so I've emptied the bladder already in order to check my weight. So then I sit down and I take my blood pressure. Now I have a blood pressure cuff because there's a group, I teach a group of blind, um, low vision people. And I had talked to them about checking their blood pressure, but they're low vision or they're blind. Well, there's a blood pressure cuff available that's audible. It will tell you what your blood pressure is. It'll tell you that, you're ready to check your blood pressure. Make sure your arm is at the same level of your heart. Do not move, do not talk, and it pumps it up. And then after it's over with, it will tell you what the reading is. So that's beneficial. Again, make sure you eat healthy, drink water. Water is important. A lot of times, especially I live in the South, I live in Alabama. Sweet tea is the national drink, and everybody drinks sweet tea, but you need to drink water. We need to keep our water intake up because that helps with hydration, that helps with keeping the blood thin and flowing, and helps keep all the organs functioning as they should. And stress management. If you're on this side of the dirt, you're going to have stress. I'm sorry, that's just part of life. You're going to have stress. But the thing is, learn how to manage it. Learn how to take care of it so it will not take you down. All right. Learn how to um, manage your manage your stress to where you can handle it. All right. You do not want it to overtake you. You do not want to have so much stress that you're having trouble sleeping, you're tossing and turning, which causes your blood pressure to go up, which causes all kinds of issues. So learn how to manage the stress my way. I pray about it. I give it to God because if he can't handle it, can't nobody handle it, okay? So that's my frame of thought. That's my frame of mind about that. And the last thing I want to share with you is to live your best life the best that you can. Um, when I was waiting on the ambulance that night, I was praying and I said, God, there's so many things that I have not completed. There's so many projects that I have not completed. But I said, you know what? If it's my time to go, I'm ready. But I would like to complete some of the things that you have assigned to me. And like I said, I thank God that I'm still here. I thank God that it was a life-threatening condition. Yes, I came face to face with my own mortality, but it also made me more aware of my relationships with my loved ones, but also to be more focused on doing those projects and doing those things that has been assigned to me. All right. So I didn't want this to be a fearful presentation, but at the same time, I want to make you aware of some things that can go on, that can go wrong. Because a lot of times when we talk about heart disease, we think about heart attacks. Sometimes we think about strokes, may think about some other things, but this is an area where it hasn't been we also think about congestive heart failure because that's one of the major problems that we have, especially in our community. But I had not heard much teaching on pulmonary hypertension, so that's one reason I wanted to share what I have for you. So I want to thank you for your attention. Everybody have a great rest of your day, whatever time of day you're listening to this, and be blessed. But at the same time, be proactive. Take care of yourself. You only have one life to live, and it is up to you to take care of it. It's up to you to make sure that everything that you're doing the best to your ability to take care of yourself and take care of your family. Let your family know what's going on. Don't be secretive. Let them know, because it may be something that they have to deal with down the line also. All right? So, have a good day, and I will talk to you later. Bye.